Hello, I'm Madison McDaniel, and today I'll be talking about emphysema. And I apologize for my voice. I am sick, so bear with me as it gets all wonky. So emphysema is a type of COPD, or chronic obstructive pulmonary disease, and it is a destruction of the alveoli, which are small sacs in the lungs that help promote oxygen exchange between the bloodstream. And this destruction and enlargement makes it difficult for the alveolar to collapse, which leads to shortness of breath and decreased oxygen levels. As seen in the picture, on the left there's a normal alveoli, which looks like a grape-like cluster, and that is separated by thin septums or walls. And with emphysema, those walls get destroyed and it leaves a big open space, which makes it difficult for the alveolar to completely collapse. The main cause of emphysema is smoking, and it could also be caused by secondhand smoking exposure, as well as dust, fumes, and pollution. So what happens is when a person inhales the smoke, harmful particles are trapped in the alveoli, and this causes an immune response of the body. And so when the body responds, they send inflammatory chemicals to help remove the particles from the lungs, but in the process, it also dissolves and destroys the alveolar septum, which leads to large air cavities being formed that are still filled with carbon, and it leads to dysfunction of the lungs. So the types of emphysema, the main one the most common one is caused by smoking and is found in the respiratory bronchioles and the upper lobes of the lungs. And then the Emphysema is a genetic deficiency of alpha-1 antitrypsin and is found in the lower lobe of the lungs. And those are the two most common types of emphysema. Some main signs and symptoms. A person with emphysema is generally called a pink puffer because of their pink complexion, and dyspnea, which is shortness of breath. They have a persistent cough, but is unproductive, meaning that there's no sputum or mucus that goes along with the cough to help. Like with an infection, the cough would try and dispel the infection, but the cough for emphysema is unproductive. They'll generally be fatigued and experience weight loss. There will be clubbing of the nails, which is where the nails become rounder and curve downward, and this can be due to the reduced amount of oxygen in the blood. Another sign is barrel chest. A patient will have barrel chest, which is caused by the lungs being chronically overinflated with air, so the rib cage stays partially expanded at all times, which gives them the look of a barrel chest. There will be increased ventilation and decreased cardiac output because the body is not able to expel the CO2, so they will try and take in more oxygen to help compensate for that. Some different types of testing that can be done to help diagnose emphysema is a chest x-ray. And this is done to show if the lungs have become inflated and have lost their normal lung markings. Another test is the CT or MRI, which further shows the amount of lung destruction. The main one is a pulmonary function test, which measures the airflow in and out of the lungs. It will typically show a decrease in tidal volume, and it helps determine that, so when you blow into the machine, the amount of air that is moved and how quickly it moves can determine the amount of lung damage. Another test is a CBC, which helps check if there's an increase in red blood cells. There will typically be an increase because the body creates more red blood cells to help try and compensate for the lack of oxygen. And it can also test for the alpha-1 antitrypsin to see if it is the genetic type of emphysema. An arterial blood test can be done to help measure the amount of O2 and CO2 in the blood to help determine if the person potentially has respiratory acidosis, and that will also determine if the CO2 levels are too high. The patient should not be given oxygen because they have become mostly dependent on CO2, so giving them oxygen could be potentially deadly. In the picture, you can see that the ribs seem very spread out, and this can be an indication of barrel chest. The main treatment for emphysema is to stop smoking immediately. Another treatment is bronchodilators, which help relax the muscles surrounding the bronchioli, and it allows for the lungs to expand and get more oxygen into the lungs and body. Another treatment is inhaled corticosteroids, which helps decrease the inflammation of the lungs, and pursed lip breathing increases exhalation rates. Oxygen, again, can only be given if the CO2 levels are low and must be determined by the pulmonary function test. So another type of COPD is chronic bronchitis. So it can be difficult to differentiate between them, but the main differences between emphysema and chronic bronchitis are that they're pink puffers, the alveoli are destroyed in emphysema, they have an unproductive cough, increased ventilation and decreased cardiac output, and they have no need for constant O2 unless determined by the PFT. Chronic bronchitis is the airways get inflamed and their hyperplasia of the mucus-producing glands. They have a productive cough. They're typically called blue boaters because of their cyanosis and the decreased oxygen into the body, and they have a constant need for O2. So, thank you.